Hi, my name is Mackenzie Bodeker. I am the founder and president of Mackenzie's Mission, as well as the Amyloidosis Speakers Bureau, and in addition, I am also a patient with amyloidosis. We founded the Amyloidosis Speakers Bureau in order to take on the challenge of bridging the educational gap that exists between the clinical education of doctors and the lack of patient perspective. And we do that through the use of a wonderful group of patient educators in hopes of leaving a more durable, lasting impression about amyloidosis so that when the dots don't seem to connect in the clinic, that doctors think about amyloidosis. So the challenge we face is tremendous.
I'm Vaishali Sanchurawala, Professor of Medicine and Director of the Amyloidosis Center at Boston University and Boston Medical Center. Amyloidosis is a systemic protein misfolding disease which is quite rare. However, it is considered rare because of the number of patients, but maybe it is not as rare as one thinks because the diagnosis is delayed, misdiagnosed, and also underdiagnosed. 40% of patients, the time from symptoms to diagnosis of confirmed amyloidosis was greater than 12 months. Moreover, more than 2 healthcare provider visits were needed for 60% of patients before confirming the diagnosis of amyloidosis. And even to our surprise, only 4% of primary care physicians were able to diagnose this disease. So what are the implications of delay in diagnosis? Very simple. Organ dysfunction, irreversible organ failure, and death. The clock is ticking once the symptoms begin. Longer the time from patient-reported symptoms to confirmed diagnosis of amyloidosis, worse is the survival. Therefore, it is absolutely crucial to diagnose this disease early and improve survival of these patients. ASB can provide education to training physicians, which will lead to accelerated diagnosis and improved patient outcomes. Accelerated diagnosis will help patient undergo treatment appropriately and also participate in clinical trials to have a better impact and also improve outcomes.
My name is Sean Riley. I'm a hereditary amyloidosis patient. Why do I belong to the Speakers Bureau? Why is it important to me? If I had been diagnosed early on, even back when I had carpal tunnel, they would have been able to treat it then, and I wouldn't have the other ailments to contend with. So it's very important to me that the word get out to the medical community so that other patients can be diagnosed at a much earlier stage of the disease.
My name is Ray Comenzo. I'm a physician and a hematologist. I work at Tufts Medical Center in Boston. One of the challenges that patients face is the range of symptoms, the spectrum of organs that can be damaged in both light chain, AL, and transthyretin, TTR, amyloidosis. The fact that a spectrum of organs includes joints, ligaments, spinal issues that TTR patients can experience means that residents in many programs, both medical and surgical, can benefit from meeting, talking with, and hearing the stories of patient educators from the Amyloidosis Speakers Bureau. I think patient educators should be regarded as gifts to young physicians.
One of the most valuable things that we receive from these students is feedback. We know that we're making a difference. They're sharing with us their experience with the Amyloidosis Speakers Bureau and the moving stories that our patient educators bring, that they will keep amyloidosis in their front of mind, that they will never forget the faces of the patients who went and spoke to them. And I think the most important part is the fact that they believe that they will be a better doctor as a result of this experience.
I'm Dr. Gordon Huggins. I direct the cardiovascular pathophysiology course here at Tufts University School of Medicine. I'm also a general cardiologist here at Tufts Medical Center. To me, the patient educator provides a unique educational experience for our students that has transformative effects on each of the students because they really get to hear about the disease from the patient themselves. And they have a window into the experiences of what it means to care for somebody who has a medically complex problem and provide a lasting educational experience that then translates into their being a better doctor.
So people ask me why I'm involved with the Amyloidosis Speakers Bureau, and I have two reasons. One, I really needed to have purpose in life because so much is taken from you when you have a disease like this. And my second reason is I felt that I could be hopefully helpful to other patients with amyloidosis by spreading the word on this disease. Many students will tell me that after seeing my presentation, they know that they will never forget me and what they were able to learn from me as they move forward in their medical careers. They think that having experienced and heard my story, they will be better doctors. Patient educator gives the medical community an opportunity to see and to hear firsthand what it is like to have this disease, what it is like to go through sometimes years and many different doctors to get to a diagnosis, what it is like to be treated, and how hard it is sometimes, to stay hopeful and optimistic. And I think it's very important for people being educated in the medical field to have that opportunity to meet sort of face to face with the person who has the disease, because nobody knows more about amyloidosis than the person with amyloidosis.
It presents things that you can't read about in a textbook or see on a PowerPoint. It presents the human side of things, the emotion, the anxiety that all patients go through prior to diagnosis, wondering what's going on. And there's also tremendous emotion when you are diagnosed, when you have to absorb and understand the gravity of the situation. So it's important for doctors to not only have that clinical education, but also have the humanity side of it, the sense of empathy.
As I mentioned, we aim to educate the medical community, and more specifically, we're looking to educate not only medical students, but also internal medicine residents. The universe is large, and if we stop to think about the multiplier effect here, it's massive. Every single one of those doctors on their own will go on to see hundreds, if not thousands of patients throughout the course of their career. So the chances that they'll recognize amyloidosis is significantly increased.
Historically, amyloidosis is not taught in medical schools, not mentioned in residence curriculum. Historically, residents and fellows in training do not get to see patients with amyloidosis. When ASB provides patient educators as speakers in the training, it complements the medical education. Patient educators are extremely powerful and impactful because of their own voice with the patient journey and treatment outcomes. They have compelling insights into this disease, and therefore the training physicians retain as well as keep amyloidosis in their differential diagnosis when they see a patient with multi-system disease involvement.
One of the most special aspects of the cardiovascular course is the involvement of patient educators from the Amyloidosis Speakers Bureau. The message we are sending to our students through the patient educator is to continue to work hard on the patient's behalf, to continue to question and to continue to explore until you've achieved the appropriate diagnosis and treatment, and not to give up or not to dismiss a patient or a patient's symptoms just because you don't fully understand them. If we only tell our students the easy questions, the easy cases that will obviously result in the answer on their multiple choice test, then they will not truly have experienced the challenges of clinical medicine and will be ill prepared for caring for medically complex patients, such as patients with amyloidosis.
In medical education, it's my strong belief that there is a major opportunity for patient educators to get involved both in medical student education and in residency education. This is extremely important for patients where we have so many effective therapies that would prevent organ damage if the case is diagnosed early. I encourage the residency program directors, the coordinators of medical education, to give a good hard look at the advantages of having patient educators from the Amyloidosis Speakers Bureau get involved in their training programs and the medical education curriculum on a regular basis, year in and year out, so that the diagnosis will be made earlier and the treatments will be available very early in the disease process so that patients and their families can engage in all of the aspects of recovery that can be equally challenging.
The testimonials on our efforts have been overwhelmingly positive, but it was important for us to determine, is what we're doing making a difference scientifically? Are we leaving a durable impression? So we assembled a team and conducted a formal study to assess the effectiveness of our patient educators. We collected the data, we analyzed the statistics, and it showed an overwhelmingly positive response, telling us that the ASB is making a difference.
I now would like to talk to all of the other course directors around the country, as well as residency program leaders, about why I feel the Amyloidosis Speakers Bureau provides such value from an educational experience. There's no doubt that the clinical content and pathophysiology and pathology content are paramount. However, the addition of patient educator and the patient voice, and in particular the authenticity and real life experience that the patient educator provides, takes all of that clinical content that has been provided and puts it into context for the student and really helps the student to move forward and be an efficient and excellent doctor.
I strongly believe in ASB because I cannot give didactic talk to the trainees, medical students, residents, and fellows with the same impact that a patient educator can have. So this is a call to action to the medical educators, to the curriculum developers in the medical school, in the residency program, in the fellowship training program, to incorporate ASB into their curriculum to increase awareness, to decrease educational gap, and to make the diagnosis of amyloidosis in the differential diagnosis to improve patient outcomes and to improve lives of our patients with suffering from this disease. It is critical that the trainees hear from the patients their journey, their voice, and their compelling insights into this disease. The results and progress in the therapeutic landscape of systemic amyloidosis are unbelievable, unprecedented, and unheard of for this uniformly fatal disease of the 1990s, but they are not enough. And therefore, we need to work together to make a difference. Please include ASB in your curriculum or didactic lectures to bridge the awareness gap and complement clinical education to improve outcomes of patients with amyloidosis.
I'll leave you with one final thought. Today, we have the treatments to change and to save patient lives. The only thing we're missing is the education, the awareness surrounding amyloidosis. So I ask you to consider incorporating patient educators into your medical education so that we can put these treatments to good use. Something this simple, having a patient come and speak to your doctors, having a patient come and speak to your students, can save lives. It's that simple.